Surgeons need skillful fingers to do their work. But nobody is born a surgeon. So how do young physicians develop enough skills to perform even demanding laparoscopic procedures? And how do they keep them even while there are no patients to operate on? Here at MEDICA Education Conference 2015, a hands-on course takes place that wants to answer these questions with a special training device. Dr. Laubert, you are a trainer here on the course about the Lbeck Toolbox. What is this exactly?
The Lbeck Toolbox is a training curriculum for young attending surgeons, encompassing a variety of components, but most of all the toolbox itself with its integrated camera, 6 subsequent modules implying or encompassing various degrees of laparoscopic skills, goals precisely defined for each of the individual tasks. We additionally have video tutorials which to a certain extent substitute the real physical tutor, and we also give rather precise definitions or recommendations on how to absolve the curriculums in terms of how often you should train for how long.
Which movements are especially difficult during laparoscopic procedures?
I would say that there is not one particular difficult movements, but it's rather the combination of different aspects in laparoscopy, the 2D/3D environment, the bimanual dexterity that is compromised initially, the fulcrum effect, meaning you have a fixed instrument at the body wall which implies different movements, you have different haptics, and these aspects all imply that even basic movements in the beginning are extremely difficult to achieve or to perform for the beginner.
There are 6 training modules contained in the box. What skills do they address that are needed in laparoscopy?
They address, as I said, the basic requirements in laparoscopy, so to say, bimanual dexterity, the smoothness of movements, the depth perception that is extremely important for laparoscopy. Those are skills that are acquired throughout the first 3 or 4 modules. We then have 2 cutting tasks, which are sub-real, I would say, which are very similar to what you actually have to do throughout an operation. And the curriculum ends with the last task, which is a laparoscopic suture, which is probably one of the most complex motor skills that you have to acquire throughout laparoscopic learning.
To whom and how often do you recommend the training?
We recommend the curriculum to actually every surgeon in training, but it extends not only to the surgeon itself, but also to gynecologists, urologists, basically all surgical fields or specialties that do operate laparoscopically or endoscopically in general. And we also recommend the curriculum to students because they really enjoy it, and it's a good step ahead if they go through the curriculum at the end of their study and they can begin maybe a surgical career having absolved the curriculum already.
When you think of other training systems or devices, what differences do you see compared to the Lbeck Toolbox?
I would say that the Lbeck Toolbox is actually unique in its entire concept. We have the broad field of virtual reality trainers, which are certainly not comparable because, first of all, they do not have the same effect, which also has been shown in several studies. They are very expensive, so they're not affordable for many smaller hospitals, and all other physical box trainers do not have this defined curriculum in terms of goals, strict definitions of each tasks and goals, as I said, and also not the tutorial. So in this context, I would say that we actually have a unique product in laparoscopic training.
Thank you for the interview.